over-the-counter medications, aka OTCs, are medications you can buy freely from a pharmacy or drugstore without being asked for a doctor's prescription. But did you know that these medications are only considered safe when used correctly? But most people make simple mistakes that can render these drugs ineffective, unsafe, or even harmful to their health. Today, I'll be mentioning a few over-the-counter medications and just explain some of the mistakes you may be making and tell you how you can do better in taking them more safely and effectively moving forward. First are painkillers like diclofenac, ibuprofen, or acetaminophen, also known as paracetamol. Ibuprofen and diclofenac are well-known anti-inflammatory drugs that are used in treating swelling and injuries. They are more tougher on the stomach, while paracetamol is milder on the stomach, but it is used in the treatment of pain and fever. Note they are not interchangeable. Taking the wrong one can make you feel like the pain reliever you took is not working for you. Also, what you need to know today is if you have ulcers or liver disease, you would want to avoid these medications completely. But if you do have to take this medication, ensure that you eat before you take them. Do not take it on an empty stomach, please, to avoid exposing your stomach to any form of irritation whatsoever. And please, if you are a heavy drinker or you're someone that is fond of popping paracetamol when you have a hangover, I would advise that you stop that today, because you're simply exposing your liver to injuries. Alcohol and Tylenol do not mix well. Please, you are causing liver damage for yourself and you need to stop that today. Second on this list are cough syrups. We have expectorants, suppressants, mucolytics, you can just name them, but you need to know your type. That is, know the kind of cough you have so that you can choose a cough syrup that is more suitable for your condition. Taking a cough suppressant, that is a cough syrup that contains dextromethorphan that is meant for dry cough, when you're having a wet productive cough, that is a cough that you're able to spit up sputum, is basically a waste of time. You're simply trapping mucus in your lungs. It's gross and it's also unhelpful. You will continue coughing and complaining that the cough is not going away, and that's simply because you chose the wrong cough syrup for your condition. Please make sure that you go into the pharmacy or drugstore, meet the pharmacist, explain what your cough is like so that they can choose the one that's suitable for you. If you choose it yourself, the likelihood of you choosing the wrong cough syrup is very high. Cough syrups are very specific for coughs that you have. It's not interchangeable. If you have dry cough, you take something that contains dextromethorphan that is clearly written dry cough. And if you have wet cough, you're coughing, you're spitting up something, so you simply want to clear that mucus from your airway, from your lungs, you should choose something that contains guanfacine. That is what you should go for. Today, at least you know better, that you should always either complain to a pharmacist when you get into the pharmacy so they can pick the one that is more suitable for you, to not prolong your cough and put you under any form of distress. We're clear, right? Capiche? And number 3 are nasal sprays. We have the congestant sprays like oxymetazoline, but they have a 3-day rule. That means you should not use it for more than 3 days in a row, else you're going to experience rebound congestion. That is a situation where your nose refuses to unblock unless you keep using that nasal spray. But what I would advise you to do instead as a pharmacist is to switch to saline nasal spray, or simply speak to a doctor to recommend something you can use for long term. That would be more preferable and of course more safer for you. And number 4 are antacids and acid reducers. Please, these are not candy. I know Tom's, Gestid and the likes look like candy. They're colorful. Some people actually enjoy the taste, but they are meant to be taken for quick relief when you're having occasional heartburn. While omeprazole, on the other hand, is a proton pump inhibitor that is meant to reduce acid level in your stomach. So you're supposed to take it when you're having frequent heartburn and other stomach irritation, and maybe after you've tested for H. pylori and it's been shown that you have ulcer. That is when you start taking omeprazole. And please, you need to take note of this. This is very important. Do not finish that spicy food or something you're not supposed to be eating because it irritates or make your ulcer start disturbing you, and then you throw omeprazole in there thinking it's going to work for you. No, you are wrong. Omeprazole is meant to be taken on an empty stomach early in the morning so that it can start working. That is how it was made, and this is how it was meant to be taken. And know that chronic use of antacids or these proton pump inhibitors without supervision by a health professional can result in serious nutrient deficiencies or even mask serious health conditions. Please take it as prescribed. do not abuse it. Do not take it longer than you should or more than you should just because it tastes nice. And number 5 are sleep aids. Example, someone taking Benadryl to be able to sleep well at night. Please reserve Benadryl for allergies. That is what it was made for. Do not abuse it. If you just use it one time and maybe it helped you go to bed, doesn't mean you should keep going back to use Benadryl to be able to sleep at night. You are abusing it. It can increase your risk of developing dementia, give you slow, sluggish and grumpy mornings, and I know you wouldn't like that. Instead, go for something that is more natural like melatonin. And also note that natural doesn't always mean harmless, okay? Take it when you need it, and know that overusing melatonin can mess with your natural sleep cycle. You do not want to depend on any drug before you're able to sleep. Please do not allow yourself to start battling insomnia. Take it when it was prescribed for you. Skip days. Try to still sleep on your own. This is how you're going to help yourself to get your sleep cycle back on track. Last but not least are laxatives. Please do not abuse stimulant laxatives like Dulcolax because you're going to make your bowel become very lazy. That is, you won't feel like going to the toilet until you take these laxatives before you're able to go. Nobody wants that. You want to wake up in the morning and be able to go, or maybe during the day and night, you're able to go to the toilet freely, not depending on any drug. And if you actually use these drugs, you abuse these drugs for weight loss, because I know some people take laxatives for weight loss. Stop doing that, because some of you don't even know that you're supposed to be taking electrolytes, ORS, oral rehydration salts, because as you're stooling frequently because you're on these laxatives, your body is losing important electrolytes and you need to actually replenish with ORS. Please take stimulant laxatives only when you're having serious constipation, and you can also opt for other options if you've tried drinking a lot of water, if you've tried eating watery fruits that can actually help you go. Try other natural options before you opt for Dulcolax. So, which of these over-the-counter medication have you been taking the wrong way? I hope you'll do better from now on. Please take note, OTC doesn't mean risk-free. Just because it's sold over-the-counter doesn't mean it's safe or it's harmless, and it goes with everything and everyone. Talk to a doctor today before you start taking any medication. Read labels and follow instructions carefully. Take your medications as prescribed. And if you're unsure, please speak to a pharmacist so you'll be more informed, so you're able to take your medications the right way. And thank you so much for tuning in. If you learned something new today, like and share this video and turn on that notification bell so you'll be the first to be notified when I drop the next video. And until then, lead a healthy life.
Thank you for the love that you give. Thank you for the way that you live. You light up my world. You make it all worthwhile. Thank you for the way you make me smile.